everyone. Look down below and tap that subscribe button. We truly appreciate your support. Thank you. Hello, everybody. Welcome to Forensic Friday. We are back for part 2 with Erin Eli, our forensic pathologist. She's going to go into more detail this time. Stay tuned. She's got incredible information to share. Just wait. Take us through a day. You know, when are you first notified that there is a deceased coming to you, or do you go to the deceased? Do they come to you? Because I know Wendy sometimes goes out.
Sure. It kind of depends on where you practice, what people do. Our office in Broward County, we only go to any of the very significant cases. So if there's something really suspicious where they just want the doctor to be out there, if there is, a plane crash, a mass fatality, those are events where we would go. I think it's important to be there. It's hard to actually do what we have to do at the scene, right? There's a lot of other factors, and you have to be really careful because you don't want to say, well, that's a gunshot entrance wound when you're looking at the body and it's 3 a.m. and you have a flashlight. And then you get back to the morgue the next day and you realize that that's not the entrance wound. So, it kind of depends. Our investigators, when you're on call, typically how it works wherever you are, you'd be on call the day before you are considered the doctor of the day or the first person up for the day. And they may potentially call you regarding a case, or if they are, if they don't have questions, they won't call you at all. Obviously during the daytime hours, the day before you're up, they may come to you with questions about cases, but then pretty much it just kind of depends, if there is something that they just don't know how to handle it, they may call you in the middle of the night. But for the most part, most of the time your calls, you don't really get woken up at night. It's not like some of the other medical specialties. Then the day that you would be up, you come in, review the list, kind of see what your list looks like.
And your list are the deceased that are there.
Yes. So, that's one of the cool things, but also the challenging aspects of our job is it's different every day, right? We can't predict who's going to die. We can't predict, it's going to be a really bad day. The hard part of that is when you have other responsibilities within the job and, somebody wants a meeting or, you're trying to plan for the day. Can you make this 4 p.m. meeting? Well, maybe, you
have no idea what you're about to discover.
Yeah. So obviously, court takes precedence, but other than that, my previous job, I had a lot of responsibilities with the university, and it was challenging for them to understand why we couldn't set up a meeting, 2 months in advance. And I couldn't say for sure if I could be there because I don't know. I think, but if I got subpoenaed to be in court, I won't be able to come. If I have a really bad day and I'm still, doing cases in the morgue, I'm not going to be able to come. And so, that's just one of the things you have to realize, but it also makes it interesting, right? You never know. You never know what you're going to get. You'd review your cases. Our office x-rays every single individual.
Okay.
So, you might find some injury that you weren't expecting. You might find an old bullet that you weren't expecting, and we still recover old bullets. And so, those things are important to review.
Have you ever done that and it solved something else?
It's never solved something else, but there is a national database for bullets. And so, we always, that's evidence that we turn over. It can be recovered and looked at by a ballistic expert, and they can say if that was the bullet from a gun that was used in any other crime. So we still recover them. Our office has a morning meeting that we do at 8:30. So it's really great. We are a teaching institution, so we have a fellow that we're training. So I think it's a really great training opportunity. We round in the morgue. Every case for the day is lined up. The investigators, I've already reviewed the cases, but the investigators will present the case. What are the important aspects of what they found out about why this individual is dead? We can ask any questions there. Our toxicologist comes, all the doctors come. We may ask, what would you do with this case? We can do any of those types of things. Then after that, you kind of decide what you're going to do with your cases and if you need help from another individual. So not every case is going to have a complete autopsy. And what I mean by a complete autopsy is an external examination. So we'll look at the body, we'll inspect the body. What's the hair? What color are the eyes? Are there tattoos? Are there scars? Are there any injuries like abrasions or scrapes, contusions or bruises, lacerations? Are any of those there? Are there any, unexpected stab wounds or unexpected gunshot wounds, those types of things? Then if it needs an internal examination, we would do the internal examination. So some cases that don't get a full examination would be a case like an elderly individual who falls and breaks their hip, and it's diagnosed and they had it repaired or they didn't have it repaired, and then they never recovered and died subsequently. So we have medical records of everything that was done, documentation of the fracture. They're older, there's no concern. We know all their medical history, so we can just do an external examination inspection and sign it out. And it won't get a full autopsy because there's no suspicion for any criminal activity, anything like that.
Yeah, but then it sounds kind of weird. This person died from a hip injury.
Yeah, but
it kind of seems weird that you wouldn't think one would lead to death.
Yeah, I mean, the problem is, right, the fall with the fracture starts that unbroken chain of events. And they never get back to baseline. So even though the immediate cause may be something different, like maybe they developed pneumonia, or maybe their high blood pressure took over, or their dementia took over, but they never recovered from that hip fracture. So, it kind of started the unbroken chain of events that just set them over the edge.
Okay.
Another type of case where we may not do a full inspection would be somebody who has well-documented natural disease. In Florida, we have a lot of no doctor cases. So it's a snowbird and their doctor is in another state. So there's no doctor in Florida to sign the DC. So it comes into our office, but they have well-documented multiple medical conditions, high blood pressure, diabetes, multiple, they don't use drugs. There's no suspicions. So we would, do an external examination and sign the case out without doing a full autopsy, unless there was some reason for us to do the full autopsy.
So if you are a snowbird and you're here, but your doctors are all back in your hometown, a doctor can't sign a death certificate outside of their state or wherever they're licensed, even Correct. If their patient is outside the state.
Correct. Yes.
I did not know that. Okay.
So obviously, there are, wherever you live, there's going to be differences, right? So in Florida, we obviously have a lot of that. Cruise ships, we get deaths on cruise ships. And jurisdiction is where the boat docks. Same thing if like you had a death on an airplane, it's where the plane lands. So obviously there are a lot of cruise ships that dock in Fort Lauderdale. So we get those because a lot of them, right, they're people coming for the cruise. They don't live in Florida. There's no Florida doctor to sign the death certificate. So most of those are, natural disease. And so it's just an external inspection and no full autopsy. We don't look at the organs inside the body. If we could, We might do autopsies on everybody. Now, some religions don't want that, right? In an ideal world, we would, do more full autopsies on everybody, but it's just not practical. We have a very big shortage of forensic pathologists. There are only about 500 of us in the country.
That's all?
That's all.
Oh my gosh.
Yeah. And so, it's a fine balance between, doing the right thing for the families, trying to make the death certificates as accurate as possible, but also being able to, not do so many cases that we're burning out our workforce. It's also challenging, right? We're trying to train individuals, but sometimes we're so busy, and finding the time to train. I love to teach. But it can be challenging when we're so busy, because obviously that adds time to your day. So if there's a medical student or, somebody who's an undergrad who may be interested in forensics, it adds time to stop and, teach the people that have an interest, but, we need people. So we need people to be interested, to join our field because there are so few of us.
Oh my gosh. All right. So I have a whole bunch of questions right now. Let me try to figure this out. All right. So you said, you have your schedule, how many autopsies you're performing that day, who you're working on. And you said you talked to the investigators, you talked to the doctors, you talked to people involved with that specific case. Now, are they in the room with you?
So we have morgue techs or autopsy techs that help assist us during the cases. But once we start doing the autopsies, everybody else typically leaves, except the people that are in the autopsy suite with us. They have multiple names depending on where you are, but they are trained technicians to help us, assist us in the autopsy.
So the police officer isn't there.
So sometimes police come to autopsies. In Broward, they tend to come for homicides, but I will say that, obviously COVID has changed some of that. So I think we're still kind of in that flux period where, COVID, when things were shut down and we couldn't have visitors. It kind of depends on the jurisdiction though. Sometimes police will come, sometimes they won't. You have some places where prosecutors may want to be there. It may be like a very,
controversial,
suspicious or controversial baby death, or, potentially a police involved. So, sometimes the prosecutor may want to be there. But for the most part, it's just the doctor, perhaps the fellow, the trainee, maybe some individuals who are observing. So like a medical student, and then the autopsy techs. And, you go about getting your cases done. At the end of the day, we're still pathologists. So we look at all the organs and diagnose any disease we see, even if it's not what killed the individual.
Okay.
You see.
Now, do you keep samples?
We do keep a small sample. So because we took jurisdiction of the body, everything has to go back except the small samples that we keep. Because if the family ever wanted, say they don't trust, people think sometimes we're in cahoots with law enforcement because we do work with them. But we're not part of law enforcement. They just help give us the scenario.
Okay.
However, maybe the family wants a second autopsy. And the only way to do that would be if everything is put back. So we put everything back except anything we may take to look at under the microscope, or it's called a stock jar. So we keep a little section. Sometimes it's important, right? Like, so you're expecting this to be a drug overdose. So you didn't put anything in to look under the microscope. And then the toxicology comes back negative. So now you have that stock jar and you can go back and, the person, the deceased individual is likely long gone outside of your office, right? This might be 3 months later when you're getting the toxicology back. And maybe you need to go back to the stock jar and put sections in to look at under the microscope to make sure there's nothing that you missed that you can't see with the naked eye that you have to look under the microscope.
And I would imagine your jar is one person's samples.
Correct. Yes.
Okay.
Yeah. It's kept separate. There's obviously a lot in forensics with like chain of custody. So yes, those are, it's just one person's samples, and, those are kept for several years, actually.
I was going to ask you several years. Okay.
Yeah. So, the wheels of justice turn slowly, especially after COVID, right? There were no trials for virtually a year. So most cases that potentially go to trial, it's about a 2-year lag. Some cases are more rapid, and some places have the right to a speedy trial. So that it's like 120 days after they're charged. But even with that, I think COVID has set a lot back. Because we didn't have trials for nearly a year. So, most cases you can think if it will go to trial, it likely would be a couple years down the road.
So what is your average shelf life? I don't know what else to say. Like, how long do you keep it?
I mean, you could keep it forever if you wanted. It's in formalin, so it's fixed. Okay. That's always kind of an issue, right? Is storage space for pathology.
Because people are going to continue dying.
Correct. But even pathology in general. So like, if you have something removed in the hospital and it's a tumor and they make slides, they actually save that for at least 10 years. Places would like to save it longer, but, storage is always an issue. Pathology tends to be lower on the totem pole, as we're not always seen as that important, even though, right, you can't function without the laboratory.
I was going to say, it sounds like you're pretty darn important to me.
But right, so finding storage space for us can be challenging. But what happens is, reasons why you want to keep that is maybe your cancer returns several years later, and now we have a new treatment that if you have a certain mutation, we can give you a directed therapy for your tumor, and they can go back and they can DNA test or test for that mutation on your original tumor too. And so keeping it as long as possible is important. They used to say that forensic slides and blocks, so the blocks are what's made of the tissue to cut the slide, should be kept forever. I believe it just got changed. Don't quote me on this, but I think it's like 50 years. But even so, right? So you need to have enough storage to be able to maintain that. And it's always an issue. So
wow, I could imagine. Now, you were saying sometimes a prosecutor or this person wants to be at the autopsy or that person wants to be at the autopsy. There's only a certain amount of time. Like, how long? Once you have the deceased in the morgue, do you have to perform that autopsy? And I'd have to imagine there's a time limit there, especially if people want to attend and now you're scheduling it.
Yes and no. So a routine case and a younger individual without a lot of natural disease, I mean, that can take about 45 minutes. If you have a case that has significant number of injuries, for example, if you have a homicide that has, 60 stab wounds, that can take a long time. I mean, it can take 6 hours. You might not even finish in one day. And the reason for that really is actually more of the external examination, because you're documenting every single injury, you're measuring it, you're measuring where on the body it is. You're trying to determine,
what caused it,
the wound characteristics. And that takes a long time. And sometimes, or if it's, 30 plus gunshot wounds and you're trying to figure out what goes to what and figure it all out before, as best you can before you get started, right? You should have, if you've looked at your x-ray and you know how many projectiles are inside the body, and then you count your wounds and it doesn't make sense, okay, there's a problem, right?
Yeah.
You're missing a wound, or is one, did a bullet break apart? But figuring as much as you can out ahead of time is important, so that, you don't say, okay, the body can go, and then you're dictating your report and you realize you made a mistake. So this can take a long time. And for example, when you're the fellow, you're slower, you're learning. So, I mean, I had a homicide where, you know, I had to hold the body and finish the next day because I just didn't finish. And yeah, I mean, obviously you want to do the best thing for the family so they can start their arrangements, but you also want to do the best service you
Thorough,
can
yeah.
and produce the best report so that, you know, potentially justice can be served for that individual.
Yeah, I would imagine your documentation, like you say, the x-rays, documenting every wound. That's very tedious, especially if there's multiple wounds, that would take a long time because, again, you might end up in court and you're going to have to, just like any crime scene investigator or anything else, you're going to have to document exactly what you did. You're going to have to almost, and I would imagine, walk them through it to show that you missed nothing.
Correct.
And that is tedious because if there is a crime involved or if there's insurance money involved, there's always going to be somebody else that wants to prove you wrong. So
Yeah.
you have to know that your documentation is spot on.
Yeah. And I would say, I mean, I think, you know, that's one of the important things. If this is something that interests you, is that you really have to have attention to detail because, you know, you don't want to miss something. You know, there are some cases that are extremely rare. And if you don't think about it, you could miss the opportunity to, you know, have
Really?
the right diagnosis. You may lose the opportunity to have a good sample to get something tested, right? You know, some laboratory tests require different preservatives in the tube that you put the blood in. And so, for example, if you're concerned about a poisoning with heavy metal, it can't touch plastic at all. So if your office holds blood in plastic without preservative, that blood can't be used. It has to go directly into a certain tube to test for heavy metals. So if you have to have this attention to detail and think about it ahead of time so that you know kind of how to proceed. And that's the purpose of why our office does this morning meeting. So maybe there's something that you don't think about. We also do an afternoon meeting at about 2:30 most days, unless it's too busy, where we go back over the cases, and then maybe you ask a question or somebody brings something up that you didn't think about. A lot of times the individual has not been released from our office, so you could go back and do something else if you didn't do it or didn't think of it. So it's
do you usually have, is that second meeting to make sure that all I's are dotted, all T's are crossed before you say, okay, we're done?
Yeah. And I mean, I think it's nice. Our office is one that's really collaborative. And I think that's important too, right? You know, we bounce ideas off each other. You know, a lot of us trained in different offices, which is good because we bring a different perspective. You know, we were trained this way. This is how I was taught to do it. How would you do this differently? Am I missing something? What else would you ask for? Those types of things. So it's also a learning opportunity for the fellow. It's a learning opportunity potentially for the investigator. Maybe you have a newer investigator who doesn't understand why you need a certain bit of information. So for example, Florida has a statute that says any potential poisoning requires a full autopsy. So
That could be a lot of different things.
Correct. But most drug overdoses, therefore, require a full autopsy. Where it gets tricky is if somebody's been hospitalized for a long period of time and we don't still have their admission blood. So we can no longer test for, what they came to the hospital with their overdose. But anyways, for all intents and purposes, right, a potential overdose of any drug requires a full autopsy. So if you get somebody who maybe is a chronic alcoholic and they were drinking the night before, okay, what does that mean? Were they intoxicated? Were they drinking a lot? Does this person require a full autopsy because they were drinking? So knowing what additional questions need to be asked so that you do the right thing for the cases and that you can appropriately triage potentially on a day where it's a very busy day in the morgue. So
My goodness. So, all right. I have 2 pages here. You've seen this. I could ask so many. How has forensic technology changed since you started?
So there are a lot of, I mean, technology is always improving. One of the things that has emerged is something called a Lodox X-ray machine. Our office in Broward County has it. It's a really cool X-ray machine where there's one X-ray for the entire body. So it's nice because in offices where you're still using plate film, they're going to have to take multiple X-rays for the entire body. Where that can become tricky, and you learn real fast when your bullets don't match up is sometimes there can be a gap, right? So they're taking a chest X-ray and then they're doing an abdominal X-ray and there was a slight gap. And the bullet you need is in that gap that they didn't overlap.
Oh my gosh.
So, the Lodox is nice in that respect. It's also really cool in that it can show calcifications in the arteries of the legs. So we get away sometimes with, a person who comes in without a doctor, but we do the Lodox and we can see that maybe they don't have a diagnosis because they don't go to the doctor, but they have, coronary, they have atherosclerosis of their extremities that you can see on the X-ray. A lot of offices have started to get CT scanning.
And what would be the reason for that?
So it can help you with CT scans are actually the one area that is superior to autopsy in bone fractures.
Okay.
So it can be very helpful, for example, in a pediatric case. There might be a hairline fracture in a rib with minimal hemorrhage that you may not see, even doing the autopsy, but having a skeletal survey with CT is very helpful in that respect. Some offices use it with motor vehicles. If they can diagnose enough injuries, again, they may not do a full examination. And so it may help them diagnose more injuries. It is, however, very technically challenging. So it requires oftentimes somebody in the office who either can read it or run the machine. So there's a lot of technical aspects with that. I will say that it's important to know, even though we have less hospital autopsies in this country now, even with the improvement in imaging in the hospital, as many as 30% of autopsies find an unexpected finding, and that has not changed over the years. So I do think it's kind of a shame that, CMS decided that hospitals don't need this requirement anymore. It's a great learning opportunity for physicians to compare what is found at autopsy and what they were treating the patient with. Did they miss something? How can they learn from that? Some of the best conferences I did were these clinical pathologic correlations where, the doctors would present what they thought. Sometimes if there were a lot of residents, the attendings would ask them, okay, what's your differential? What are you thinking? And then we would present what we found at autopsy. And, was it something that they missed? How can they do better with their patients? What does this mean for the patient? And the family? What does this mean for the survivors? Is there something, is there some malignancy that, other family members need to get screened for or things like that? And so I do think it's a shame that, that went away because we have seen a significant decrease in the number of hospital autopsies, and families are, if they want one, sometimes it's, well, you can get a private autopsy, but that costs money.
Yeah. How much is something like that?
It kind of depends on where you are and what the person's going to charge, but it could be $3,000 to $5,000. And the
Does
person
insurance
also
help with that at all, or is that straight out of pocket?
It's typically straight out of pocket. And you also have a funeral to plan, and so it's just not realistic for a lot of individuals. And it's a shame, right?
Yeah. And especially because say this person's being treated because their symptoms presented this way. So the doctor's been treating this. And then after an autopsy, you realize, no, this is actually what this person died from. And then you realize, okay, just because something presents this way doesn't necessarily mean that's the best treatment. So it's an eye opener that there could be, different things present multiple ways.
Yeah. And there's also, right, there's also education. Maybe, maybe when they were intubating the patient or putting the breathing tube down the throat, they accidentally went into the esophagus. So we can say, hey, it was in the wrong spot. Okay, does this person, was it their first time intubating, or is it somebody else who maybe needs more education? Or, hey, that chest tube ended up in the abdomen. Go back and review, does somebody need more training?
I would imagine, and you don't have to answer this, but if there's a mistake, something like that, I would imagine they don't want an autopsy because that's a lawsuit.
Potentially, but actually, I, having worked in an academic institution as a forensic pathologist, I think people think that, but actually some studies have shown that family members are less likely to sue because they have definitive answers for why their loved one died. I think, if the doctor can then go back and talk to them about what happened. I think it is hard, right? In medicine, we're expected to always be right. You always hear it. Oh, well, if they miss something, I would never go back to that doctor, but we're still humans and there's still going to be mistakes. But how do you learn from it? And how do you even know that you made a mistake?
Yeah.
And how do you learn from, thinking it was this, but it was actually something different. So if you ever get another patient that maybe you can't figure out what's going on, but you had one who had an autopsy and revealed
exactly,
maybe you'll think about that next time. So,
oh my gosh. So, well, then after everything I've heard, this sounds like a crazy question, but what's the most difficult part of your job?
I would say when we can't give answers, when it becomes an undetermined. I want to give them answers. It's the most challenging time in the life for most of the family members, right? They've lost a loved one, usually suddenly, unexpectedly. They would like answers. Maybe it's a baby that died suddenly and we can't give them answers, and that's not comforting. I want to give them answers. I want to have an answer for why this individual died, but what are we missing? You go back and forth. Is there something I did wrong? Should I have, sent something else out? But, there's, if we had unlimited funding, we do genetic testing on every single individual. Sure. But you want to give the best service to the families. And, when you get the undetermineds, they're just not fun to then call the family and talk to them and explain why you can't tell them an answer. I mean, I think some good advice I got though from a mentor was that you tell them what it's not. You can show all of the things you did, all of the things you looked at. What is it not? But still, right? It's still, you don't have answers, and that's hard.
And is that sometimes simply because there's just the unknown, or is technology and forensics hasn't caught up with a way to see it or to diagnose it or to figure it out? And in cases like that, do you revisit?
You can. I mean, even, sometimes offices may go back, say eventually they find a new drug and they think back, hey, we've had a bunch of cases that we think potentially were overdoses, but were negative. So let's go back and test them. Sometimes.
And this would be a good reason why you keep your specimens on the shelf in case you have to go back.
Correct. I think sometimes, for example, baby deaths, a lot of them are unsafe sleep. And I think some of that hinges on a good investigation. If you don't have investigators who are properly trained how to ask the questions, do a scene recreation, while it is challenging, right, to ask a family that has just lost their child to recreate what happened. A lot of coroners don't do it. But I don't know, I don't get the story that this baby was placed face down on an adult bed with a pillow and a blanket and somebody lying next to it. So I may think that those babies oftentimes show nothing at autopsy. So if I don't have a good story, again, autopsy alone, just by itself is not good enough. It's one piece of the puzzle, like we talked about. It's the totality of the scenario. And so, you do have to know that, what we say is always based on the information at that time and can always be amended. You can always amend a death certificate. So should more information come forward later? Oh, a parent admits that they smothered their child.
So there's not a statute of limitations on something.
Correct. Or again, you have an undetermined and then you find out there's a new drug in your jurisdiction and you go back and test some of the things and, oh, this person took this drug that you weren't able to test for at that time, you can change it. So it can always be changed. But again, it's just, you want to give answers to families, right? That's who we serve, are the families, the bereaved. And to not be able to tell them why their individual died can be challenging. Or even sometimes the manner, maybe you do the autopsy and they already knew the cause of death, but why can't you tell them why that occurred? Maybe I had an individual, I feel so badly for his mother. He was found nude outside with a severe head injury, just a bleed, no other injuries on his body. So it's called a subdural hemorrhage. Those are not anything that would happen natural. It's, from high velocity. So he was assaulted. He was potentially hit by a motor vehicle. Although interesting that he doesn't have other injuries on him, or potentially he fell and hit his head and had that. Now nothing was ever able to be found. There's some surveillance video of him walking down the street. But there's nothing around, there's no video where he was found. Nobody has ever come forward. She knew he had the head injury while he was in the hospital. I didn't tell her anything different with the autopsy, but I can't tell her the manner about how that came about. And that was hard, right? And I would like to give her answers, but at that time, the investigation has not yielded any reason for how this occurred. So I can't say, and that's hard, right? And it's hard for her.
Here's a question for you. So we'll take an example. You had said that you had started an autopsy, but you had to, for time restraints or what have you, you finished it the next day. So say you start the autopsy and you've seen the body, you've examined the outside, you're going through your process, but then the next day when you start again, do you notice any bruising that develops after that? You go, well, wait a minute, I didn't know this injury was here.
Yes, sometimes bruising appears more slowly. So sometimes if you have a baby case that really doesn't make sense, sometimes people will hold the deceased individual for a day to see if any bruising appears that you couldn't see initially. There's other things that we can do as far as looking at, more of the soft tissue. But still, some people will still want to hold it just in case more bruising appears, particularly in places where you're not going to make cuts like the face, places like that. So yes, sometimes things do appear more after, a time period.
And I would have to imagine that could change the entire dynamic of the autopsy. It could go from one thing to a homicide just based on a bruise that develops.
Sure, potentially, yes. So just knowing that is important, right? Especially if Right. That's why the scene, and some doctors, right? So some trauma surgeons may not have the history when they take the person to the operating room, but that's why history, what is the scenario? What happened when this individual was found? And then when you're doing the case, does this make sense? If it doesn't, stop and pause. And what other information do you need to understand why this occurred? You have somebody floating in the ocean. They're a good swimmer. Okay, what's the scenario? Why is that person out there? Were they swimming? Did they get caught in a current? Did somebody dump them out there for a reason? There's so many things.
Yeah, you don't just say, well, the body was found in the water, so it's a drowning. That's not
Right.
necessarily the case.
Right. So, again, everything is important, but then, it's still the practice of medicine. So the history is so vitally important, and the scene and what, so that you can put the pieces of the puzzle together to give the right answer.
Okay. Now I'm going to ask a question. You may not want to answer it, or you could tell me if you knew of anybody else that went through this. Given the fact that you're going to be putting together the autopsy report, the cause of death, manner of death, all of the information that is needed, whether it be a crime, insurance, family, whatever, there could be people in higher positions that pressure an answer. Have you ever had to deal with that, or know of anybody that's ever had to been pressured to provide an answer that may or may not be true or too soon to give?
So I have not. I feel like that is more in the coroner system. So obviously, as a medical examiner or a forensic pathologist, I'm biased, but I think the coroner system should go away in our country.
Because they're elected. They don't have background to do this.
But they have a lot of political power, right? Now, I will say some states with, a very spread out population, a lot of rural areas, it may be challenging, but I think really they need to figure out a way to do that. So a coroner is an elected individual, like you said. Some places have zero requirements. They may not have even graduated high school. They decide in their jurisdiction who should get a forensic autopsy. They have a forensic pathologist who performs the autopsy and tells them cause of death, but they determine manner. And that's problematic. To me, it's the practice of medicine without a medical degree, right? You're saying I, as a medical examiner, to practice in an ME system, I need a medical degree, I need pathology training, and I need forensic training, yet you are allowing somebody to make these decisions. In places like California, there are some coroners who are also the sheriff. So now you have potentially a police or an in custody death, and they're trying to determine manner. That's
a massive conflict of interest.
Yeah. In fact, there was one jurisdiction where the MEs left because they felt that they were being bullied by the coroner. And so personally, I have not, but I have always been under the coroner, the ME system. There are some states like Ohio that the coroner has to be a physician, but it's almost never a forensic pathologist. So again, they didn't have all the training we have. They still, physicians, as we've talked about, still struggle with death certificates. Why are we still having this system in our country when we could be on a complete medical examiner system? Again, it would take a lot of work in some of the states that have more rural areas. Some states are joint medical examiner and coroner. So they're, medical examiner in the big cities and coroner in the more rural areas. But I think if we looked at it logistically, we could figure out a way to make it just an ME system.
Well, we need to get a bunch of people to go to medical school and start doing what you did and following your path. And so that happens because you're also, you need more.
Yes, we do. We do need more. One of the good things is they have done a lot with the public servant loan forgiveness. So a lot of us, because we work for government, we work for jurisdictions, we're considered public servants. So it's a way to get your loans potentially forgiven after paying for 10 years. They've done a lot because we have needed people with increasing our salary. We used to be one of the lowest paid pathologists, but that's no longer the case. We're starting to see increases in salaries because—
Congratulations.
Thank you. Because, if you don't pay people, then how are you going to get people to come there? And so they've seen that and realized that and have started to pay us better for what we do. So it's not as bad as it used to be.
Oh my gosh. There were so many great questions, but honestly, I think through this whole thing, you've been able to answer so much of it. Another question was, part of what you do is looking at a specimen, histology samples under a microscope. What are the things you look into to determine CA?
So sometimes you see something that you take a section of because it's, an abnormality in the tissue when you're looking at it. So we look at all of the organs. We slice them to be able to look at more narrow pictures to make sure there's nothing that we're missing. There's a lot of benign tumors in the kidneys and the liver that I see a lot of. And I look at them under the microscope just to be sure for the family. But then sometimes maybe it doesn't, you don't really know why this individual died. So you may just take a random section of the more important organs to hopefully see if you find something that you can't see with the eye. Like we talked about, sometimes you don't always feel pneumonia. Pneumonia has a more firm feel in the lungs, but maybe you're not feeling it. So hopefully if you take some lung, you see it, maybe there is some odd nodule, and you don't know where, potentially it's a tumor and you don't know where it came from in the body. So you might be able to tell that. There's, sometimes you might find, inflammation. The myocarditis that I talked about is inflammation in the wall of the heart. We can see that in babies. It's typically a viral infection that leads to that. You can see it in older individuals too. So you hope that the section you took may show that under the microscope. Again, there's not really a good sign of that when you're looking at it grossly with the naked eye. Things like some things you really need more of a microscope to make sure you're not missing something.
Oh my gosh. Here's another question. Explain the different methods to estimate the PMI.
So I feel like some of the CSI shows have done us a disservice. So people think that we can give a very good, accurate time of death. So somebody is declared dead when, it depends on where you are, what the rules are, but somebody comes there, whether it's, the EMS or EMTs who arrive and pronounce death. Some places the law enforcement can pronounce death, but somebody pronounces the individual dead. The best indicator of when somebody died was when were they last known alive. And it was sometime in there, right? When was their last text message? When was their last phone call? We can look at some of the things to get an idea. However, it's not very accurate. So rigor mortis is stiffening of the body. That is loss of something called ATP in your muscles. The muscles use that as energy, and it dissipates from the body, causing the body to form rigor. It sets up in about 4 hours, becomes fixed, meaning fully developed, in about 12 hours, and then dissipates thereafter. Some studies say it's gone by 36 hours, but they've shown that people have held it for up to 6 days. So, right, we have this wide range. Again, a lot of this is hard, right? We don't do a lot of studies regarding this, but the ones that they have done have been in very fixed environments, and people don't die in a fixed environment.
It's hard. You can't plan that.
Yeah, and a lot of things factor into it, right? So if the person is in a big struggle before they die, they have depleted the ATP in their muscles and it hasn't redeveloped, so their rigor may set up faster. There's other things that we can look at, something called lividity. or Rigor Mortis. So that is the pooling of the blood in dependent portions of the body. It also sets up in about 2 to 4 hours, becomes fully fixed in about 12 hours. And by that, it means if you touch it, it won't blanch. So it's fully fixed. But it's more helpful in knowing if somebody was moved, or if you're worried about like a positional asphyxia where somebody potentially suffocated and you can see that they were face down and then there's sparing around their mouth and nose because that was in contact with whatever, surface the individual was on. And so you're more concerned that that's how they were, or, the person was moved because the lividity is on their back, but somebody is saying they were face down. Well, that doesn't fit. Yeah. So because again, it was done in a fixed environment, and just because, I've had cases where, it's 24 hours later and it's still kind of blanching, even though technically, right, at 12 hours, it shouldn't be blanching. Another one that people talk about is Algor Mortis. That's the cooling of the body. There is a formula we can use. It's not very accurate. Some offices do a liver temperature on everybody. And that's the formula, I believe, is made primarily with liver. But a lot of factors affect that. So what's the temperature outside? How much clothing does the individual have on?
What was the AC, the heater, where in the house?
What was their temperature? Is it a hyperthermia case and their temperature is 108 because they're, overly heat exposed? And so, right, we don't know where they started to where they got to. So again, it's not really accurate. Another thing that you can look at would be fly activity. So the most common fly is the blowfly, and each little thing adds another day about. Again, it's about. So if you have fly eggs, that adds a day. There's 3 different stages of maggots that each of those stages adds about a day. Then you'll have pupal casings. That adds about a day. Flies adds a day. Dead flies adds about a day. It can
you got to work it backwards.
Yeah. So, but again, it's hard to say for sure. And flies can have access. They can start laying eggs as soon as the body dies. So just finding a body with fly eggs doesn't really tell you much, right? Because
it could happen just then.
Yeah. And it becomes really tricky in places that are not like Florida, that have varying temperature degrees, particularly in like the spring and the fall, because flies don't fly below 40 degrees. So if you have a day that's really warm and then at night it gets into the 30s. And so then you're trying to calculate this, but you have flies that are flying during the day and then not at night. And so, even like
that could throw your day off.
Yeah. So, you can use it, if you really needed to be more accurate, potentially you could send, any of the bugs to an entomologist and they may be able to give you a better accurate, but again, it's still just an estimation, and we're not as accurate as television leads you to believe we are in estimating that. Unfortunately, really, when was the person last known alive? Okay, it's somewhere in between, when they're found deceased and when they were last known alive. And unfortunately, that's a hard answer for some families too, because they want more concrete answers.
Especially if there was foul play, they want to have someone held responsible.
Right.
Oh my goodness, you have been such a joy. I have to ask, what is the hardest case you've ever worked on? You don't have to get specific, but challenge. I shouldn't say challenge. What is the most challenging case you've ever worked on? Because you've rattled off a lot of challenges.
I would probably say one that was very personal for me. So one of the things I do in my free time, primarily as a stress relief, is that I do Olympic weightlifting. Snatch,
didn't expect to hear that.
Snatch, clean and jerk, those things. We do a lot of squatting. I had a weightlifting coach who was a coach, a friend, and he took his own life in my jurisdiction.
I'm so
And
sorry.
it's all right. I was on call. It was, my office was great in that they didn't make me do the autopsy, but it was still extremely challenging. The thing about it, though, that has helped me is that was my first experience with a very personal suicide. And I deal with suicides all the time. I deal with the family members. And I know on a personal experience what they're going through. And I think it has made it easier for me to relate to families. But I will say that it was it was terrible. It was the only time in my career that I felt like I needed to quit my job. It was just, it was hard. You have guilt that you should have done more. We had an argument recently before that, and you think back to what you said, and, it's just, but then, I deal with families that are experiencing the same thing, and I feel like I can better relate to them going through that.
And thank you for sharing that. That was incredibly personal. And when you said you're better to relate to the families, do you share that how they feel? Or do you just keep it about them and what they're going through? Do you try to find that you truly do know how they feel?
No, I try to keep it about them. Oftentimes families just want somebody to listen to them. Sometimes, right, it's even just not even saying anything, even if they are very upset, and potentially, screaming at you, sometimes just listening, and allowing them, it's the most challenging part of their life to some extent. And just giving them the opportunity to talk about things, and allowing them to cry or, talk about the personal aspects, and know that their loved one mattered. Yeah, I don't try to, I feel like maybe potentially once or twice I've gone down that route, but I feel like, again, you try, like you said, you try to keep it about the family. So.
Yeah, because I would imagine at some point, it's like, and I can only speak from my example, you can't always say, I know how you feel, or I'm so sorry that, there's different ways that you handle it. And I'm sure the first, of course, I don't even know if you say that, but when people say, how could you possibly know what we're going through? Well, in some cases you do, and that might be beneficial.
Yeah.
So I didn't know how that would be handled, because you truly do have felt that grief.
Yeah. I didn't think about it that way. Yeah,
I guess you'd probably have to take it case by case. If it presents itself to be handled that way, I'm sure your instincts will kick in. I just wasn't sure.
Yeah. We provide a great service for the families, but also it can be challenging, right? Because they are, at a point in their life where they just really need answers, and you may not get them for them. We're not always, we respond to families, but it's not always immediate, right? You may be in the morgue, you may be testifying, you may be off that day. And that can be challenging too, right? They want answers, or you can't really give them an answer yet because you don't have the whole case together yet. And so again, you just try to provide the best answers you can, and oftentimes just be a listening ear. I think one of the awesome things that our office is trying to do, modeled after some other offices that have done it, is get a family advocate. And it would be somebody who is trained in social work, They'll have a direct line where the family members can have this person's number. They can call this person and get information about the case if needed. That person can get the doctor involved. But it provides better service for the families and for the bereaved. And so I think it's really awesome. We're working really hard on getting that position approved and then hopefully filled so that we can provide, better service.
What about for you and the staff that is dealing with such tragedy on a daily basis? How do you cope?
For me, it's weightlifting.
So back to the Olympic, not Olympic weightlifting.
Yes. I don't know. I mean, some of the things my coach stressed, right? Just be grateful every day you get to touch the barbell. And to be honest, the barbell does not care if you have had a terrible day. They don't care what kind of cases you've done. You can lift the weight or you can't. It requires focus and, there's just something to me that's so stress relieving about squatting. You might have the weight of the world outside, but then you have this weight on your back and squatting it and, lifting this weight. And it's still also something that's healthy. I think everybody needs to find something that is a stress relief for them. It could be yoga, it could be meditation, it could be weightlifting. But it's just for you that is a stress relief. Sometimes my kids come out into the garage, but for the most part, it's, something that is just for me and helps keep me healthy, both mind and body, so that then I can, come to work and do my job and be better for also serving, our population.
Well, Erin, you are fantastic. I have enjoyed this conversation so much. I know people are just going to you can't stop listening. There was just so much information given. You were so good. You were so thorough. Clearly you're good at your job because you're just thorough in conversation. It has honestly been an absolute pleasure meeting you, talking with you, listening to you explain, what a forensic pathologist does, how to get there, a day in the life. It's far more than I ever thought. All of you deserve a standing ovation. You're incredible. And we should be very, very thankful. I'm not in Broward anymore. I'm now in Tennessee, but everybody back in Broward should be very thankful they have you.
Oh, well, thank you. I have enjoyed it. I mean, I'm happy to, if you ever come up with more questions you want to ask. The only way we can get people to think about this as a career is exposure and know that this is a career. This is something that's out there. It's interesting. We need people. So come.
And there's only 500 of you.
Yes. I think they say only about 1% of graduating seniors in medical school choose pathology. And of those, a very few choose forensics. So we just really need people to get interested as early as possible and see it as a potential career path so that we can continue to build our field.
Yes. And build more Erin Eli's. Oh my gosh, Erin. Well, thank you so much for being on Forensic Friday. I have, again, had just a wonderful, wonderful experience with you, and I would love to have you come back on anytime.
Sure. Thank you. My pleasure.